When you look at a lot of doctors versus the associations here in Washington, we have had tremendous input from doctors themselves. Dr. Price himself, a doctor, is the one who crafted this. At the end of the day, this is about patients and about the input from doctors who are on the front line of seeing patients and talking about the care that they're able to give or not to give to people.
Well, it was White House Press Secretary Sean Spicer defending the GOP Obama replacement plan amid strong backlash from major American doctors groups, including the American Medical Association, the AMA, in fact, the latest medical group to oppose the replacement plan, calling it, quote, critically flawed. Here to discuss, Liz Peek and Dr. Stephen Reisman. Doc, AMA, I know, doesn't represent all doctors, of course, but I think it's the largest, at least, medical doctor association out there. And they've got some serious misgivings with this. Are you in step with them on this?
Not totally, actually. The AMA claims they're concerned about people losing coverage, but they're not really discussing all of the cost issues that are really the underlying root problem of our healthcare system.
Is that an authentic concern, though, or is it just talking their book? In other words, they had the key was that you were going to get an avalanche of customers. So if the prices went down, it would be offset by all this new business. Or is there a legitimate concern? Because I can't get a Republican to give me a straight answer on, will more people be covered or less people be covered?
I think the big fear is that some of the Medicaid patients will lose coverage. I think that's what they're really talking about. But again, I think the big problem we're having in healthcare is cost. Hospital costs, we know, we spend in this country $3.2 trillion a year on healthcare. 32% is hospital costs, $1 trillion. These are the issues I think that have to be discussed. Why the AMA is against this, they claim it's people losing coverage. Is that the truth? I'm not sure.
Liz, this plan is being promoted as not about total coverage, but quality of care. It's one thing to have insurance. It's another thing if you can't afford to use it.
Yeah.
Right? And people
exactly.
did lose their doctors. It did nothing that it promised. The cost curve was bent higher, not lower. So we know Obamacare in of itself was an unmitigated disaster. Is this the right way to go, with focus being on care rather than broad, poor coverage that people didn't really have honest access to?
Well, I think the important thing to remember is this is the opening salvo, right? This is phase one of a three-phase process of a new approach being rolled out. And they are guaranteeing more competition, lower costs, things that people, I think, can applaud. As far as the AMA is concerned, it's about a quarter of America's doctors that belong to this organization. It's basically a lobbying group. My take is they want a seat at the table. There's a lot yet to be resolved in terms of regulations, the actual legislation, et cetera. Things like tort reform, very important to doctors, obviously not in the reconciliation part of this. So, I mean, I think that this is sort of, hey, we don't like some of this stuff. Medicaid is certainly a problem. That's a problem for the left and some people on the right in some of these organizations. But what they really want is to have a voice. And I think that's kind of what we saw today.
Doctor, you talk about cost and price. We all know it's one-fifth of the economy, but who gives up something? Do insurance companies give up profits? Do hospitals bite the bigger bullet? I mean, they already have it's pretty tough, as it is. Or are doctors willing to give up something here? If it's too expensive, who bites the bullet?
Everybody bites the bullet. Look at Europe, look at Israel. There, the GDP percentage is 7, 8, 9%. Here, it's 18%, double. There's no excuse for that. Hospitals are number one, 32%. Number two is 20%, physician and clinical services, about $600 billion a year. Number three is pharmaceuticals. It's about 10%, about $300 billion a year. We know all the pharmaceutical inflation and gouging. We know the hospital costs when you get $30 for a Q-tip in the hospital. And a lot of the physicians and clinical services have to be cut back. The only way to do this is to actually control the costs. The costs are not controlled. We could talk about tax deduction. We could talk about tax credit. That's not getting at the root problem. Why does the United States have 18% of GDP going to healthcare with no improved clinical outcomes?
All right, guys. Thank you both very much.